Afternoon for us with Dr. Stuart Finder. Dr. Finder is the director for the Center of Healthcare Ethics at Cedars Sinai Hospital in LA, as well as the son of Temple members Mo and Laren Finder. Doctor, how are you?
I'm doing pretty well as far as I can tell.
You know, you're living in an American epicenter in a challenging time of rising cases,
Yep.
but also a light at the end of the tunnel with a vaccine. And that's really what I'm hoping to get to pick your brain a little bit about today as an ethicist. You know, it seems that there are conflicting values in, do we use the initial doses of the vaccine to prevent death or to slow the spread of this deadly virus? Do we give it to elderly who are more prone to die, or do we give it to younger people who can't seem to control their behavior long enough not to spread it to others? Who gets this vaccine?
Yeah, no, you've asked the pertinent question, and it really highlights that what we're talking about is a public health emergency, and so we have to look at it in terms of what in the long run is going to be best for the health of our society. So I think part of the reason that the initial group that was identified, which are the frontline healthcare providers, and then people who are living in congregant facilities. Oh, sorry, that was my email. Let me turn that off. Uh, the reason that those individuals were identified as your first group is because that's how you get the most bang for the buck in the long term. We know that the spread is huge in skilled nursing facilities. Something else I know you're about to ask: jails, um, other places where you have people who live in dense corridors and they don't have the ability to do the physical distancing and separation. So once you get that spread, you're going to have not just increased death, but you also are going to get increased spread because, again, I'm going to use the jails as the example. The people that work in the jails, it's not just the prisoners who are there. The people that work there, they leave and they go back to their community. They go to their homes, they go to the grocery store, they go and they're in their neighborhood. So you get spread. So you have both concentration of death and spread. So that's why congregant living was top priority. Obviously, healthcare providers, because they're on the front lines. And if you look at the kind of exposure that, for instance, bedside nurses have compared to other kinds of providers, it's significantly greater. And hence, they have a much higher rate of infection, which means they're out of the workforce. So you then lower capacity to take care of people when they get sick. And you also then have higher percentage of death for that group. So you see how these things are actually tied together. But all of it has to be understood as this is about something that will, in the long run, be best for the community. And that's a different type of orientation than most of us traditionally have lived our lives.
And particularly when it comes to vaccinations, where right when it comes to the flu vaccine, we're looking at children, we're looking at those who are vulnerable. And my understanding is this isn't children aren't approved for the vaccine and would not be where it is most effective right now.
Well, so yes, the studies did not include none of the studies that have been ongoing. So both the Pfizer one and the Moderna, which have gotten the emergency use authorization, the AstraZeneca, which is in process, which will probably be the next one come January or February, they did not look at using this for children under the age of 12. Now, part of that was because early on there was a view that children did not seem to suffer very much from this virus, so they didn't include them. Going forward, I think in the years to come, because we will likely need to have new vaccines, we're probably going to have boosters. Um, they're going to do that. But the same is true for pregnant women. I don't know if everyone knows that pregnant women also were not included in these studies. We are still, like at Cedars Sinai, we still recommend that pregnant women get vaccinated, but the studies did not include them. So there's limitations due to the speed at which these trials were put together, and so we're going to have to adjust in light of that.
Sure. Let me ask you a question about the frontline workers, right? We realize now as a society that there are many who allow for us as a society to continue in the patterns we've currently been living. Delivery drivers, fast food restaurant workers, people who are meeting daily needs, but in a le- in an important way, but not in a healthcare setting. How do you begin to who comes next, I suppose, is my question,
Right.
after the medical professionals and the elderly in a group setting?
Um, it, your question is right on the mark, and I will send you a link that maybe you can share with people. There was a wonderful story in the New York Times back in March. They haven't updated since then, but at least is helpful to give people some view. Um, what they showed in this online story is actually a series of graphs that the axes, one of them is frequency of encountering public, and then based on their type of encounter, the likelihood of getting exposed to virus. And near the top are grocery workers. So there's actually a lot of people who are in those essential roles, non-healthcare essential roles that we really need to think about. And again, I'm starting with the most obvious. You can shut down restaurants and bars, and you can shut down retail stores. You can't shut down grocery stores. In fact, the only alternative is what happened in Wuhan almost a year ago. Next month it'll be a year ago, which is when the Chinese shut down Wuhan, they literally made everyone a prisoner of their house and they delivered food because they realized that, well, you can keep people from going in the streets and all, but if you don't give them food, this thing goes into chaos quickly. We're not going to do that, which means even under the worst conditions where we would limit people's mobility, we still have to have people go and get their food. We still have to now think about it. We still are going to have people who can have electricians, plumbers, air conditioning and heating, repair occur because in Pittsburgh it's a little colder than here, although it is chilly here. It's like 50 degrees. Um, if your heating system goes out, you need to have repair people. So I think that we really need to think about um, what are the most essential of those non-healthcare provider individuals. And that's part of what has been going on. The CDC has been organizing and they have released who they think meets those criteria. That's available for anyone to see on the CDC site. But these are the questions, and I think we need to now think uh, not about ourselves, but again, public health. Who in our society do we really need? As we are demonstrating right now, there's a lot of things that we used to think, well, we have to be together in person, but we actually can survive. I don't know if I want it permanently to be over video, but we can do a lot of things over video. But you can't get food, you can't see your physician, you can't have repairs to your plumbing, your heating, your electricity so that your house is actually safe. Um, your police and fire workers, they need to be able to come and take care of the population, ambulance drivers. So I think we need to start thinking that way. And it's probably less significant than, people who cut your hair. Your hair can grow long and it can get cut later. Nails can be done sometime later. Even clothing, I can order online, but then you do think, gee, all that stuff I order from Amazon, there's people at Amazon warehouses. So maybe they start to move up because to be able to keep us as a society going, there are people in warehouses that we have to think about.
I'm honored to be here today with Dr. Stuart Finder, Director of the Center for Healthcare Ethics at Cedars Sinai Hospital. I'm delighted so many of you are joining us as well, and I would encourage you to use the comment box to share questions you might have. Let me pick up on a thread that you've just mentioned. So if you, right, where the role of the individual meets their responsibility to society. So if you're working in a grocery store where you are coming into contact with a great number of people, but you are relatively young and healthy and are not considered part of a vulnerable population. There could be an argument made that you should pass up the opportunity to be vaccinated until everyone who is more at risk. And there can be an argument made because you're encountering so many. How, how do individual choices factor into these broader societal needs?
It's a great question. Um, I think that we as a society have lived under the illusion, and much in our society reinforces that illusion, that we are individual, that we're, and it'll sound funny, we're individuated individually. So that what we are as an individual somehow is defined literally by the surface of our skin. And that's what I am as an individual. And I say that's an illusion because that's actually not how, if you critically think about how you live your life, that's not true. Um, all of us live in relationship. We live in relationships at the most immediate sense with our families, because even family here doesn't have to mean literally blood relative. There's people who live under bridges, and their family are the people who live under the bridge with them. But we are relational beings. So how we are individuated turns out to be socially. And that is true from the very beginning of what all of us are. After all, I come to be already within the context of a male and female coming together. And whether they're my parents or whether it was just something that happened to happen and then dad disappears, I literally, as a physical being, whoever I am, comes into being within another. So I'm already by origin relational. And that's how I survive. And so part of what we're talking about here is when you say, so there's young people that are out and about and they can spread. Notice that we're already talking about us as social. So we have to now think, what are the responsibilities we have as part of social community? And that is not something that's determined by the surface of my skin. That's determined by the relationships I have. And the illusion is our culture has reinforced that somehow the choices I make are only about me. I get to choose whatever is good for me, individuated this way, which is an illusion because it's always about me in relation to you. So I think that we actually have to do a better job of messaging that, of reminding people that we are community people. Interesting and significant maybe that certain religious communities have had this as a core recognition from the very beginning, even to the point of, why is it, and I've actually had this conversation recently with some folks, why is it that 2,000, 3,000 years ago, there's this repetition of don't forget the widow, the stranger, the orphan? Well, my guess is because people were forgetting that. Just like right now, people are thinking, I just got to look out for me, as opposed to don't forget those people who are most vulnerable. Because this is also part of the human condition. When the push comes to shove, we often fall back into the just me as defined by this, as opposed to just me as defined by this, the openness of the community.
It's fascinating to think about and eventually to turn around into a sermon. So thank you for helping me write that opportunity. I'm curious though where the line might be drawn. We saw in the news this week that British Airways, unique among airlines, was requiring a test to go from the UK to the United States. Um, do I realize airlines and other businesses and synagogues for that matter are legally allowed to require vaccinations? Is that good policy? Is that an ethical thing to do? Should we prevail upon people to make these choices if they are unwilling themselves to do so?
Yeah, I think that this is another one of those interesting challenges about how we understand ourselves as a community, because our community will always include people who don't follow the rules of the community but take advantage of um, the positive elements that you get from being in community. Uh, Again, that's historic. Just read literature, read religious writings. That's part of the human condition. Uh, so, so at this point, there's a. I want to introduce another element, which is who's flying from the UK to the US right now, anyways. We're already talking about economically privileged people. Who is it that is suffering the most from the COVID pandemic? Turns out it's not the economically privileged people. So it's an interesting question, but it's like it's reinforcing a misplaced emphasis, because what we really need to look at is who is actually most vulnerable and how we're going to protect them. Because if we don't protect the most vulnerable, then we are reinforcing a self understanding of what is valuable for our society that actually says if you aren't of a certain kind, we can walk on you. You're our doormats. It's really good that you pick our fruit and you pick our vegetables. But when it comes down to it, you're expendable. We don't care. Which doesn't make sense, because if they don't pick our fruit and our vegetables, we don't have food. So actually, they're not expendable. So how do we take care of them? So yes, it's a great question about the airline, but that actually is a misdirection, because that is a really small piece. That's not what we should be focusing on. We need to actually look at it in a much more global, social, public health way. How do we help our greater good?
Do businesses, do, let's set aside governments for a moment. Do businesses, do nonprofit organizations, do synagogues have an opportunity, though, to push people into that bigger question, whether or not you see this as your responsibility to others? Okay, I can't go to Disneyland unless I'm vaccinated, could be Disney's way of forcing you to take that consideration seriously.
Yes. And that is, you really want to have this as a conversation. I get it. So, yes, I think that British Airways, Disneyland, um, anybody, the to go see the Steelers, cry, but to get into the stadium, whatever you want to do it. Yes, if the organization says you need to have proof of immunity, whether it be vaccination or previous infection and demonstration of having enough significant antibodies that you're not infectious, um, sure, that plays an important role. But I do think that it's still a misdirection to put all the emphasis on that, as opposed to, and here's your sermon, we have an obligation to remind people that at this point in our nation's history, we should not be worried about going to Disneyland. And if the thing that matters most to you is going to Disneyland, you need to reset your priorities. Not because you can't go to Disneyland next year, because when things are different, you'll be able to go. But right now, that's not what you should be worried about. So the issue of I was having this conversation with my daughter who lives in Germany. She and her husband live in Germany. The idea of resilience. So for almost 10 months, we've been dealing with this, and a lot of people are thinking, I just can't go further in this isolation. I need to go out and shop or go to the wherever. Well, do you really? See, this is an opportunity to discover where your priorities actually are, where your limits are. And if you end up missing some sort of family event, my daughter got married and we were not able to go except via, electronic. We could be there, but we weren't able to be with her when that happened. It's terrible, but is it the end of the world? No. Is it something that I would rather have my parents be healthy than me physically being next to them? Yes. So I start to learn where those limits are and what I can, in terms of resilience, what I can actually respond to in a way that is actually good, because now I'm starting to really focus on what is the good in my life. And that's what we should be focusing on, not I really want to go to Disneyland. Okay, Disneyland says I have to get a vaccine. I will somehow move up in the front of the line so I get the vaccine so I can go to Disneyland because it's about me, me, as defined here. That just, it doesn't actually fit with, you can speak to this, that doesn't speak to Jewish values. It doesn't even speak truly to American values, even though there is the myth of the American individualism. Just read about the founding of the country and what it was that the conversations were that our founding forefathers were having when they wrote the Declaration, when they wrote the Constitution, and what the debates were like, and how there was compromise, which is already to acknowledge it was about a social good, not an individual good.
Interesting. I'm fascinated by all of this, and I love your ability to keep us focused on what matters most here. Let me explore for a bit vaccine hesitancy, right? I'm not sure I can trust the science. I'm not sure I can trust the emergency authorization. I do trust it, but I'm not sure I want to go first. I want to see what develops. How does what would you say to those who are feeling hesitant in this time?
So there's a couple things. One, I'm going to acknowledge that I'm feeling hesitant at these times. I'm one of those people that's feeling hesitant, uh, but I can give an account, which I will try to do uh, in the context of this response. The science actually, first of all, is both new and not new. I think that once again, there hasn't been very good messaging about some of this. So the Pfizer vaccine and the Moderna vaccine, as I think most people know, are a new form of vaccine. They're based on using a piece of genetic material, mRNA, and having that be what I get when I get the vaccine, which causes me to manufacture a piece of protein that is the protein that you find on the coronavirus. That causes my immune system to then respond with building antibodies because it recognizes that protein as foreign. Well, the mRNA technology is new, but it's not new as in the last 9 months. Um, it's new as in the last 15 years. And actually, studies of mRNA based vaccines and mRNA based medical interventions that were believed to be therapeutic really began in earnest about 7 years ago, 8 years ago. There's a great article that's a review article from Nature, the magazine Nature, the journal, from 2017 that looks at, I think it was about 20 at that point, clinical trials that were using mRNA as a delivery system and mechanism um, for different therapeutics. So this has been going on. First of all, mRNA, and in particular, mRNA for coronavirus began shortly after the second wave of the SARS-based infection, which was the one that's known as MERS, which was Middle Eastern respiratory syndrome because it occurred in the Middle East. And that's part of why the Nature article was actually in 2017, because that was in the mid part of the teens. So they started working on the genetic makeup of the SARS type virus, which, remember, coronavirus is actually SARS dash CoV-2 virus, right? It's a SARS in the family of SARS. So we were already working on that, and then this new virus occurs, and it was just fortuitous. We had already, scientists, had already actually done the genetic coding. So this wasn't new. It's been around. And in that sense, there are studies that show that there's no real long-term adverse events. But of course, long-term here, now it's not so old. It's only 5, 10 years old. So it's not like you could look at measles, mumps, and rubella vaccine, which has been around for 50 years as a combined vaccine and say, well, no, we have a lot of evidence about that. It's not that old, but it's not brand new that this just started to be used for the very first time in the clinical studies that began in July. So the safety part of it, in that sense, people should feel rest assured. Um, but there's so much that's still unknown. Having said all that, for instance, we don't know if getting vaccinated will protect you from spreading. In fact, we don't even know if getting vaccinated will protect you from acquiring the virus in a way that allows the virus to still live within you. Um, a lot of vaccines, when you get vaccinated, what happens is if you get the organism is killed quickly enough so that you don't get sick and you don't spread it. We don't know about these vaccines and COVID because we actually didn't study that. The only way we'll know is give us a couple years. So there might be hesitancy there because we don't really know, well, if I get it, I'm protecting me, but am I protecting you? And isn't that my concern? But remember, we do have ways that are really effective to protect you. This, see, that's why I wear a mask. It protects you. So the vaccine is really for me. So there's also an irony here. Here it is that the ethics guy has been rambling on and on about, don't think about me, think about the sense of us. The vaccine is actually all about me. That's what it's good for. So I, for one, have not signed up to get the vaccine yet. And in part, it's because I actually don't think that I should be given any more priority than anyone else. I am lucky enough that I can do my work remotely if I have to. Yes, I work in the hospital, but I can talk to people on the phone. I can talk to people on video chat. There's people who are much more in need and deserving. And so I just need to keep doing the things I've been doing. Wear my mask, wash my hands, keep physical distance. And eventually, if it's 6 months from now or a year from now, I'll get vaccinated. I think the other thing that people might be hesitant about is while the vaccine, the Moderna and the Pfizer ones, are based on an mRNA model which has been used before and there has not been any long-term effects discovered, there is still theoretical risk. With every vaccine, there is risk. This is a theoretical risk, but it's a risk, which is mRNA. Well, if I get mRNA, that's not my mRNA. I'm getting an artificial mRNA. That's a different type of foreign entity in my body than if I get a piece of a virus that's been killed and then I get it, like in the polio vaccine, or a piece of virus that's been so whittled down that it's no longer infectious and won't hurt me. That's the yearly flu shot. But at least it's a foreign thing that comes into my body mounts a response, and that's how I get antibodies. That's how I get immunity. This is, I get a piece of genetic material that causes my body to make a protein that is a foreign entity, and my body responds to the protein. But what about the mRNA? See, that's a foreign entity also. Is there any long-term effects of that? I know that there's some people that are worried about that. So far, it's a theoretical risk. There hasn't been any demonstration that it causes any harm. mRNA itself is very short-lived. So in the vaccine, you get a huge volume of mRNA so that you can have enough mRNA that will live about a day because it naturally degrades. As mRNA tells your body to make this protein, the mRNA then dies. It's kind of like some of those insects that they live long enough to reproduce, and as soon as they reproduce, they die. mRNA is that way. But at least you have mRNA in your body that's from a foreign source for maybe a day. Does that cause any long-term effect? Nobody knows, but everyone in the science world has acknowledged that's an unknown theoretical risk, and now we have to balance that unknown theoretical risk from the real risk that is currently here with COVID. So if you're, I don't know, 91, you should get vaccinated, because the chances of you dying if you get an infection with COVID is really, really high. If you're 25, well, now we get back to long way around. Your chances of dying if you're 25 and get COVID is not as high as if you're 91, but your chances of spreading it are pretty good. So if there's a chance that it might protect you and someone else, then you probably should get vaccinated. And that is more important than some theoretical long-term risk. If you see how this is going to balance out, you have to actually pay attention to the facts and the details, and then put it in the context in which we're living right now.
It is a theoretical risk that I'm growing excited to get to take. We've received a question from someone who is with us, but I think you answered the question already about whether you're not taking the vaccine now so that more is available to others parallels the circumstance of the questioner. And I would simply ask that questioner if it is true, or if I should ask it in a different way. But while we're waiting for that, allow me to explore another possible area here. As vaccines are rolling out, as Pfizer and Moderna are doing their best to manufacture and deliver these vaccines, states across the country are receiving fewer than they would like, right? We don't have 300 million doses on tap ready to roll. We know that there is some protection offered by receiving that first shot. So if you're the state of Pennsylvania and you've received, I have no idea, throwing out a number, 500,000 doses, do you vaccinate 500,000 people and then hope the second dose comes in time? Or do you half that, giving it to only half of the people who may need among that very first tier, knowing that you'll be able to give them the full course? How do organizations make these decisions?
So in the same way as what I was trying to do in the last long ramble was to remind people that there are facts out there and there is data. The studies have shown that for the Pfizer vaccine and the Moderna vaccine, they were developed, designed, and studied to be a 2-dose vaccine. They were not studied as if we give 1 dose and compare it to 2 doses, and what are the outcomes of those. So just like the theoretical concerns about mRNA, there's suggestions based on some of the anecdotal evidence of those studies that if you only get 1 vaccination, you still have some good protection. But that wasn't actually studied. So the question here, as you're posing it, is, so I have 500,000 doses in which I could protect 250,000 people at basically 95% efficacy. Or I could give it to 500,000 people and see how it works. And I really don't know.
A follow-up, it's a challenge.
That would, yeah, but that would be like saying, okay, so I know that the recommended daily allowance of protein and minerals and vitamins is X, whatever it is. But I also know that there's some people who can live on half of that. So how about when we're in a critical food shortage, we'll give a quarter of it to everyone? Because, you know, if some people can live on half, maybe some people can live on a quarter, and we'll just see what happens. That really, is that how you would want to do it? I think, you know, for my child, I think what I want to do is, instead of giving them as a baby their 8 ounces of milk a day, I'll just give them 4 ounces. Well, why? Oh, because I think it might work. And I'm maybe exaggerating it a little bit, but the move to use the vaccine as a one dose is based on actually speculation because it wasn't studied. It wasn't designed, and it then wasn't studied to be used as a one dose vaccine. So it's a speculation. So even if there seems to be some strong anecdotal evidence that a one dose use of this vaccine could be protective, it's speculative. And so, on what basis are we going to say that speculation is worth now pursuing? And it's not just really 500,000 because we're talking about, in the Pfizer case, 20 million doses. So we're not talking about a small number of people, that we could be giving them a vaccine that would be ineffective and in the process would actually be then wasting this very valuable social resource. I, I feel the pull of it because the pull of it is we really want to try to protect as many people as possible. But you don't protect as many people as possible by giving them something that has an ineffectiveness component that may actually be significant.
Interesting. Thank you. A follow-up from an earlier question from our questioner. So, do you have a sense of how the operation? I'm not even sure that was a word. How the vaccine is going to be rolled out, such that if you opt out, if you say, right now I'm in a condition where I'd rather leave it for others, are you necessarily at the end of the line, or will there be other opportunities in each cohort, or don't? Is that more of a state by state? Don't we know about implementation yet?
Yeah, it's going to be. This is kind of, in a funny way, it's a funny thing. So there's a rollout that is national to states. Then each state rolls it out. Each state then is using different mechanisms to roll it out locally because in the end, everything is always local. Um, so at our hospital, for instance, we have a mechanism in which all of the healthcare providers sign up who are interested in being vaccinated, and based on certain criteria, they get slotted into different priority groups. There's 12 different priority groups. So I actually could sign up and I will be on the 12th priority group, which means I would not be getting any vaccine until you get vaccine because there's just not enough to go through all of these priority groups. But that's because in LA County has allowed each individual hospital to do what makes the most sense for its individual hospital. There are ongoing talks right now in LA County for how that distribution process will work for the broad community. And it's going to be a coalition of different organizations in LA County. Well, why is LA County deciding how it works in LA County? Because California as a state has left it up to the county departments of public health. So the state has some criteria, but then it's local in terms of how to work. So there's these different layers of sort of structure. And in California, it allows those structures to be utilized. Pennsylvania may work completely differently. I have no idea. Pennsylvania may say this is how we're going to do it, and everywhere across the state will be the same, whether you live in Pittsburgh, Philadelphia, Harrisburg, Du Bois, wherever. It's going to be that way. If we were in Germany, where my daughter lives, the federal government, working with the 16 states of Germany, basically dictates how things go. So the federal government gets input from the locals, the local, so to speak, the 16 states of Germany, but the federal government actually dictates everything. And so their distribution of vaccine, their distribution of testing, everything is top down. We don't work that way as a society, so it will be different depending on where you live, and it may even be county by county, not just state by state.
It's fascinating to consider. It is still hopeful, even with all of the different considerations. And I guess my last question for you, or my last perhaps opportunity, when we had opportunity to speak last, we ended with the importance of masks and washing your hands and other steps we might take not only to protect ourselves and others. it seems that even though there is a vaccine on the horizon, a return to normalcy, whatever that means, is still a ways off, that we still have a societal responsibility to one another to step outside of our individual selves and continue doing those things to keep others safe. I realize your crystal ball isn't any better than mine, though you have a better vantage point to look. Do you have a sense of timing, or do you have a sense of what are those big things that we should be holding to help us get through this challenging time?
So, yes, I have no crystal ball. Um, Sometimes even my glasses get foggy and I just can't see at all. But I do think that realistically, people need to recognize that the crisis we're in literally today on December 23rd, 2020, is going to get worse. Everything points, unfortunately, to the way in which the American public, at least, it's true in other countries too, but right now the American public is acting in a way that probably for the next 4 weeks to 6 weeks, it's going to get worse, which is hard to believe. As you know, and you mentioned, LA is the epicenter in the United States right now for COVID infection. Our hospitals are nearing literally capacity. Um, Beds at certain. I was on the phone this morning, uh, talking to colleagues at two different institutions in Southern California that are about to run out of beds, and their ICUs are about to be done. They just have no more physical space. They also don't have staff. Done, full, and it's going to get worse. That's bad. So we have to recognize that, and people need to try to restrain themselves a little more than they have. That said, with the vaccine, and the fact that, in an ironic way, as more and more people get infected, you do start to have some herd immunity. Um, right now in LA County, for instance, it's estimated that 1 in 5 have been infected with COVID at some point during the past 9 months. So when you have 10 million people, that's a lot of people. Uh, with the vaccine, we're going to slowly create a much larger population base that is protected. But that's going to take 6, 9 months easily, easily. So we're going to still be wearing masks probably into the summer. Not, I have no doubt. We may be wearing masks past Rosh Hashanah and Yom Kippur. It may be past Sukkot. It may be next Hanukkah. We'll still be wearing masks. But we'll be doing that because we'll be at the very tail end of the crisis, not the tail end of infection of COVID, because COVID is probably going to be around just like flu is around for a long, long time, which means some of these habits that we've been developing, which are always good habits. I'm pretty sure that my mom told me that I was supposed to wash my hands before I eat. And, I should be doing that. I didn't always do that. But now maybe I'm doing that a little bit more regularly. Um, that's something that's going to be with us for a lot longer. People are going to have to pay more attention. And if you are vulnerable in terms of health conditions, you're going to have to probably pay much more attention to your social outings than you previously did. Turns out maybe you were always just as vulnerable, you just didn't know it. Now you know it. So I think that we're going to be in this for actually quite a long time, and it's going to be a new normal. In the same way as some of us really remember quite fondly and well when we would go to the airport to meet a loved one or be met by loved ones at the gate. I remember coming home from a conference, and my very young children standing there with flowers, and like that was very moving and touching, or standing there with family as they board a plane and you are waving goodbye, and you're crying a little bit because they're going away. And well, that hasn't been since 2001. Life changed. That is a gone, past, distant memory. There are things that will now be different in the future. Now, some people hear that and they go, "Oh, that's terrible. I want the past to be as I want the present to be as the past." But that's never been the case. Um, and that's where we need to take more advantage of, and I think a lot of us do this. Talk to your elders and you learn about, well, what was life like before there was a computer? What was life like before there was easy long distance phone call? What was like life before there were refrigerators, when there were ice trucks that delivered ice? There was actually an ice box. I mean, before people could travel, and if you were an immigrant, you left home and then you sent letters, and that was like the only communication you ever had with your family again, unless they also were able to come across the ocean. Like, and that wasn't that long ago. Remember, that was not that long ago. Life changed. Suddenly you could fly. You can do video conferences. You can keep food in deep freezers that we have in our houses. I mean, things change all the time. That's not something to worry about in a fearful way. It's actually something to embrace. How will we take advantage of that to further bind ourselves to one another? Because again, when it comes down to it, we've always been connected. We're relational beings. So I think it was when we talked last, I remember we talked about this because it came out of Pittsburgh, and it still bothers me on TV when I hear people talk about social distance. Now, physical distance. We got to maintain physical distance so that we can maintain our social connection. Um, so there's a way in which, how can we maximize sociality, being social with one another during these challenging times? And that's actually a positive. A lot of people are doing things like having regular video chats with people that maybe they just used to take for granted, old connections that now they make a concerted effort to do that. Um, that's something that hopefully will go forward into the future, even when you still have the ability, if you're wealthy enough to fly across the country, you'll still regularly video chat with your brother and your sister because you can. And we should do that more often. We ought to text more often. We ought to do things that maybe we weren't doing before. So I see it as all of this as an opportunity of how to strengthen the bonds.
You've used the word rambling several times, and my new personal most hated part of COVID-19 is that I can't fly to LA and follow you around all day. I absolutely love this opportunity to learn with you. Thank you again for enriching this community. I realize that there are others who need you now and will need you in the coming days longer than I, or longer than us, or more urgently than us. But I look forward to this conversation continuing into a new year, God willing, as we begin to turn a corner. Thank you, thank you, thank you. Stay safe, stay healthy, keep doing this important work.
Well, thank you for giving me the opportunity. And again, I think that everybody needs to remember who you are, which is, we are a community and we live in community, and we have to take care of each other. That's what this is all about. If you're not doing that, I'm not sure what being alive actually means.
Amen. Thank you so much.